Okay, these are the basics on demographic data depending on different pediatric conditions. First is age, that can be in days, weeks, months, or years. Second is sex, that can be male or female. The address or a residence. The fourth is birth, place of birth, and also mode of delivery, cesarean section or SVD, and why. The fifth is informant and relation of the informant to the child, and also we should ask if the patient was self-referred from home or referred from the hospital, and the reason of the referral. We should also know the chronic illness, if there, and for how long, the medication used, if used on regular or irregular, and also the clinical attendance, if regular or irregular. If it's an IDS patient, we should know for how long, and we should know the baseline CD4 count and the current CD4 count. We should also ask for the ART regime and also the prophylaxis, if any. We should also ask for any documentations, discharge summary, and CTC card, and any medication that the relative has with them. And if the patient was in the ward, we should know when the patient was admitted. Something to note is that this demographic data sometimes depends on the age and the condition of the patient. For example, in birth, it is more pronounced in neonate, more than 4 years pediatrics, and this will depend on the more you plug pediatric patients, the more you know what are the essentials for certain aged pediatrics. Next, we will proceed with chief complaint and later history of presenting illness, which will be talked on the next session. But let me talk about review of other system. On review of other system, I'll speak on common things to ask on different systems of the body. First, I'll start with head, ears, eyes, nose, and throat, on which you should ask for any pain, any bleeding, any lump, any discharge from ears, eyes, or nose, sneezing, if the child is using mouth and breathing, and even snoring. On central nervous system, the common things to ask are fever, loss of consciousness, seizures, collapse, blackouts, if there's any dizziness or loss of balance, and even headache, problems in vision or hearing, tingling, and also spasm or involuntary movements. On cardiovascular system, common things to ask are awareness of heartbeat, shortness of breath, difficulty in breathing on lying flat, air hunger at night, lower limb swelling, ankle swelling or facial puffiness, and also history of bluish discoloration. On respiratory system, common things to ask are chest pain, difficulty in breathing, nasal discharge, any cough, whether productive or dry cough, and also hemoptysis. On gastrointestinal system, common things to ask are abdominal pain, heartburn, difficulty in swallowing, painful swallowing, nausea, vomiting, change or loss of appetite, weight loss or weight gain, constipation or diarrhea, bloody in stools, history of yellowish discoloration. On genitourinary system, common things to ask are painful urination, blood in urine, waking up to urinate at night, and any change in frequency in micturition. In musculoskeletal system, common things are generalized body weakness, pain in limbs and back, and also muscle pain, joint pain, stiffness, or any swelling. And I will finish with hematopoietic system, on which the common things are easy breathing and bleeding tendencies. On past medical history, common things to ask are previous admissions, the number of times, the cause, and also the time that the admission took place, history of trauma or surgical intervention, the number of times, reasons, and when, and also history of blood transfusion, the number of times, reasons, and when, and also if the patient is on medication, and the type of medication, the route, the duration, and the compliance. Also history of any food and drug allergy, and if it is a girl, a grown-up one, we can also ask for age of menarche, last normal menstrual period, duration of menstrual cycle, and also duration and amount of bleeding in menstrual period. And lastly, we ask history of chronic illness, either diabetic mellitus, hypertension, tuberculosis, or sickle cell disease. Then after this, we go to antenatal history, following natal history, following neonatal history, following immunization history, following dietary history, following developmental milestone, and lastly family and social history, which will be explained on the next video. Thank you.